Welcome. I'm Tequila Davina from everydayhealth.com. This is episode 2 of our 4-part series on racism in healthcare, brought to you by Everyday Health, the leading online consumer health and wellness resource, WFAE Public Radio in Charlottesville, North Carolina, and Clear Health Costs, an organization that offers transparency around health costs. The number of deaths from COVID-19 among Black Americans, which has been disproportionately higher than any other race or ethnicity, has revealed long-standing racial inequities in our nation's healthcare system, especially around who receives what kind of medical care. Indeed, many public health officials, as well as government leaders, have declared racism as a public health crisis. In this series of dialogues with experts and advocates, we explore how structural and institutional racism has impacted our nation's healthcare system, and more important, what can be done about it. Leading these discussions is our host for the series, Mary C. Curtis. Mary is a columnist at Roll Call and the host of the CQ Roll Call podcast, Equal Time with Mary C. Curtis, which examines policy and politics through the lens of social justice. A senior facilitator with the Op-Ed Project, Mary has contributed to NPR, The Washington Post, and The Root, and has worked at the New York Times, The Charlotte Observer, and the Baltimore Sun. A Nieman Fellow at Harvard University, Mary has received awards from the Association for Women in Communications and the National Association of Black Journalists. We want you to be part of this conversation, so be sure to add your questions in the Q&A, and we'll get to as many as we can. Take it away, Mary.
Thank you so much for that great introduction and for introducing this important series. Well, we've been examining the systemic racism and the legacy of white supremacy that in fact shape every facet of American life. Our healthcare system does not provide equal care to all, and that worsens the health disparities that are baked into the system over centuries. It is, as we have sadly seen lately, a matter of life and death. In this series of conversations, we will be putting names and faces on the crises, highlighting experiences, challenges, and the action of those who have been doing the work that benefits many, often working through their own pain. Our guest today is actress and activist Alicia Cole, and she developed flesh-eating disease, sepsis, and 3 life-threatening antibiotic-resistant infections after what was supposed to be minor surgery. Cole remembers the racial bias she encountered at the hospital as clearly as the physical trials she suffered. The experience of Cole and her family over more than a decade of hospital stays turned her into a vocal patient safety advocate and one of the very few people of color in this growing movement. While bedridden and recovering from 6 additional surgeries, Cole, with a Talk to Type program, began blogging about her experience and advocating for improvements in healthcare. She helped co-sponsor and lobbied successfully for passage of 2 California patient protection laws. In 2015, she was honored by President Barack Obama for her advocacy work and appointed to the Presidential Advisory Council for Combating Antibiotic-Resistant Bacteria. She continued in that position under the Trump administration until February of this year. And her journey from survivor to champion has been featured on so many shows, including ABC's 2020, The Doctors, CBS and Fox News. And she's also been profiled in USA Today, Health Magazine, Consumer Reports, Health Leaders Media, and the LA Times. She works with the Department of Health and Human Services and the Centers for Disease Control and many others that you can read about. But I want to thank her. Thank you for joining us today, Alicia.
Thank you for having me. Before we get started, can you hear me okay? Because I was having some technical difficulties here. I couldn't hear you, the whole introduction and everything. I was like trying to read your lips.
Oh, no, no, no. Well, I think we have it. Everything is set now and ready to begin a conversation that I know our listeners would be interested in. So I wonder if you can start off by telling us a little, I gave them a little points on what you went through, but a little bit about your experience and what surprised you most through all of it and how you were treated.
Wow. Okay. So I'm going to give you the super condensed version because
Okay.
it's been over a decade of healthcare experiences. I'm like a 12-year case study in American healthcare. So in 2006, I had 2 small fibroids that needed to come out. So I had elective surgery and went into the hospital, top-rated hospital, did all my research, and fibroids are a common occurrence in women, but especially African-American women. And they were 2 small fibroids. What should have been a 2-day hospital stay to get in and out turned into 2 months, 6 additional surgeries, almost having my left leg amputated, almost dying twice in the operating room. I ended up with sepsis, Pseudomonas, MRSA, VRE, and necrotizing fasciitis, which is flesh-eating disease. So I left that operating room with a host of superbugs that could have killed me. And when I left the hospital, I was facing an open wound for 3.5 years, 5 months of everyday hyperbaric oxygen chamber treatments, every kind of medical modality you can think of. And so it took basically 10 years for me to heal. Cut to 10 years later, I'm thinking I'm doing really well. And this is something that's relevant for COVID. Since 2007, I've had to wear masks when I go into large groups or when I'm on a plane because I'm a very, very high risk patient. And I went to a festival of lights out with tons of people. I didn't have a mask. I had run out of hand sanitizer on my purse. If someone said, "Hey, would you hold my camera and take a picture for us?" I did. That next morning, I woke up and my head felt like it was in a vice. It was just, I was sick as a dog. I was bedridden for 2 days. So I ended up going to the emergency room. My friend Latoya said, "No, something is not right. You're going to the emergency room." She took me. The emergency room doctor was on top of it. He did everything right. He said, "Ma'am, with your history and with what you have going on, we're going to keep you overnight, at least for observation. It looks like you might be having the early signs of sepsis. So we want to be cautious." I said, "Okay, thanks, great." Kept me. The next morning, the infectious disease specialist came, looked at my chart and said, "You have sinusitis. That can resolve itself at home." And I said, "Well, but I'm a high risk patient. You'll see in my chart. And seems like I'm having early signs of sepsis." He said, "We'll send you home with some antibiotics." I said, "Yeah, but the antibiotics I would have to take are so huge and so big and so massive, and my stomach would get all out of whack. And then I'd end up back here with C. diff." And I said, "Can we wait until we get the lab results back? At least let's see what we're dealing with." And he said, "Ma'am, we did basic labs. You don't have pneumonia. You don't have influenza." And I said, "Well, I don't even have signs of those or symptoms of those. Why would you do those tests?" And I said, "Well, have you swabbed me for MRSA or anything?" And I said, "I don't feel medically safe to leave the hospital right now. Can we wait till the lab results come back?" And he said, "Ma'am, I'm the best infectious disease doctor in the Valley. No one's going to tell you anything different." And he walked out of the room. He did not come back to see me for 2 days. And the nurses took care of me. And during that time, my condition deteriorated. The infection went in my bloodstream to the weakest part of my body. And the next thing I knew, I had an abscess deep in my hip on the side of my original infection. By the time they took me to surgery, I had 5 tunnels heading towards my femur and was in jeopardy of losing my leg all over again. So 10 years apart. I had 2 instances of hospital-acquired infections and doctors not listening, dismissing me, and all of those things. And I think that goes into the part of your question asking about the most hurtful things
Mhm.
that surprised me. I was surprised at the dismissiveness and how I wasn't listened to, especially the second infection after I'd been a patient safety advocate for over 10 years. Um, and the initial infection, the things that not so much affected me, but the way my parents were treated, sitting at the bedside. I'll give you an example. My father, uh, every time he would step out into the hallway to give me privacy, because my wound went from my right hip all the way over to the middle of my left butt cheek. And it was so deep, they were going to put a breast implant in there and then try to cover it with a skin graft. Everything in my abdomen below my navel and across my pubic area was gone. I looked like a shark bit me. So my dad would go into the hallway to give privacy when they were doing the dressing changes. And without fail, every single time he went in that hallway, someone on staff, a nurse, someone on staff would come up to him with either dirty laundry in their arms or a barrel of it or a trash barrel and try to give it to him. And finally, my dad, he'd say, you know, my daughter's in the room there. I'm a dad. I'm here. They're doing a dressing change on my daughter. And so finally, my parents went to the nurse manager, the nurse on duty, and said, listen, can you say something? Can you do something about this? This isn't right. You know, um, he's not a janitor here. And they shouldn't be coming up to a patient's parent, assuming just because they're Black, that they're the housekeeping staff. And this was a teachable moment.
Yeah.
This was something where they could have learned about culture and how to communicate with people and racial profiling and implicit bias. And she looked at my parents and she said, well, I mean, what do you want me to do? We don't get many Blacks in this hospital, so there's nothing I can do. And my parents were like, that's not the answer.
Yeah. Wrong answer, right?
Wrong answer.
I
Absolutely.
know. And you're dealing with illness as well. Is this, I mean, obviously we don't have segregated hospitals as we used to, but as you said, there are the subtleties and the nuances that really go into, it hurts, how are you going to recover? And even the physician not listening, feeling that he knows your own body better than you do. Can you talk a little bit more about how this subtle and not so subtle racism can really affect treatment and outcomes?
Oh, absolutely. Absolutely. With my second infection, it absolutely had an effect on what followed and what ensued. The 2 additional surgeries, almost losing my leg again. Here was an infectious disease specialist. Now, mind you, I was sick. I'd been sick. I was sweaty with fever, signs of sepsis. And honestly, I believe he made assumptions. You know, my hair wasn't curled because I'd sweated it all out. I had a plait here, a plait there, a plait there, just to keep from having a big old afro. I was sweaty. I looked sick. I was worn out. He probably assumed I was homeless. He probably assumed I had no insurance. Later, he admitted he didn't even read my chart once he saw that they said it was sinusitis.
Mhm.
Now, here I am. I've worked for 10 years on advocacy. At the time, I was supposed to be in Atlanta at the CDC at a HICPAC meeting. HICPAC is the organization that comes up with the evidence-based best practices that infection preventionists follow. Now, I'm supposed to be at a meeting in Atlanta as a patient advocate advisor for the group that decides how this man does his job. And I can't get him to give me basic cultures and sputum. And when I said, you know, I'm a high-risk patient, shouldn't I have a MRSA test? He looked at me and said, no, ma'am, we don't, that's only if we're having an outbreak, and we're not having an outbreak. And I said, no. high-risk patients who've had MRSA before and are showing signs of sepsis should have their nasal passages swabbed for MRSA, not only for my benefit, but for the protection of other patients and staff. He said, ma'am, that's not correct. And I said, oh, yes, it is. Because you know what, sir? I'm a co-sponsor of that law. It's called Nile Law. It's named after 15-year-old Niall Calvin Moss. And you are in violation of the state of California law for patient safety and, screening and testing for patients who are at risk for MRSA. So here I am, it was so devastating and hurtful to me.
Yeah.
The hardest part of that second infection was it almost broke my spirit. I almost gave up patient advocacy after that because I felt like I've been doing this for 10 years. I'm laying in my hospital bed looking at a poster about what you do when a patient shows signs of sepsis. And I was at the CDC and I was on committees with Health and Human Services that interviewed patient advocates and sepsis survivors and helped design those posters and what you do and how they said it and the language for health literacy. And I could literally see from my bed what they were supposed to be doing. And I knew from my prior, they weren't doing it.
Yeah. Yeah. And the point is basically too, that even if you hadn't helped write those laws, that they're supposed to do that for every patient.
Every patient.
And so,
and I'll tell you the kicker.
It wasn't happening. I know that you said, you told me in a previous conversation that you were a born teacher. And that instinct, how is that kicked in? Because you're doing all this while you're fighting the illness. So you're going through the thicket of the system, but you're trying to take notes so you can improve the system for others. So how does that even work?
Well, I've always been a believer that if people know better, they do better. That's what I try to give everyone the benefit of the doubt. When they know better, they do better. And I try to expect that and hope people rise to the occasion. And I taught 6th grade and I taught developmentally handicapped students back in the day. And I learned as a teacher, people learn in different ways. Some people learn through statistics. Some people learn through visual. Some are audible. And you have to approach people in different ways. And so even in the midst of my treatment, I would try to watch and see what they were doing. And I could see if there was a variation in the way that the nurses were doing things. And I'd ask questions, why are you doing this? What does it do? How does it help? And I would try to share it with, rather than tell a nurse, you're doing that wrong. That's not the way the other nurse did it. I'd say something like, well, I know, Nurse Carol, she tried this and it seemed to work really well because she said it does this, this, and this. That way, I didn't make anybody feel like I was putting them on the spot, putting them down. They didn't know what they were doing. But here's the way that's supposed to be done. And so I try to teach and I work with patients and families how to get the best care. I work with nursing school programs and policymakers because I believe that in order to affect change, you have to start with awareness. People have to be aware that there's even a problem. And that's why I'm so happy about this discussion today, because there's so many people who don't realize the racial strife and chaos that you see in the larger world. It invades the hospital as well,
Yeah. I also know that you got your message through because you're a pretty amazing actress with a list of credits. Did you sometimes have to perform when you're feeling one thing and you're communicating another?
Oh, yeah. Well, and the basis of acting is communicating. And when you're in a scene with someone, I have a teacher named DJ Sullivan, and she said the goal of any scene is to find the love in that scene, to find the love between those two people. You may hate that person, you may not like that person, you may not get along with that person, but what is something about them that's lovable or likable? And you'll find many actors, when they talk about playing villains, they try to find what is the humanity part of that villain. And so I know how important it is to be able to communicate and find that way to connect with someone who may not like someone who's in your skin,
Yeah.
you
Yeah.
know?
Yeah. I know you're also using your experience, which was specific. Tell people why it's important for all Americans to realize how your specific story points to the fact that we do have an American healthcare system in crisis.
Oh, we do. And when we talk about racism, it's not just African Americans, but we are the most prominent because we're so visibly different. You look at my nose, I don't care how light my skin is, I'm a sister girl. Okay. This deepness in my voice, all of that. But I've been in a situation, I have a neighbor who's Venezuelan. And he ended up back in the hospital after a knee operation with pneumonia because when the nurse put the incentive spirometer in his take-home bag, the little plastic that you breathe in to help your lungs, he's like, oh my God, they're going to think I'm stealing. They always think us Mexicans are stealing. So he took it out of his bag. And because they didn't give him instructions saying, when you get home, make sure you're doing this exercise and make sure you're strengthening your lungs. He wasn't doing the exercises. He ended up getting pneumonia and ended up back in the hospital. But it was all based in the fact that when she put that in his bag and didn't say, I'm putting this in your bag, take it home and do these exercises, he was so used to being labeled a criminal. Even though he was a wonderful person, not a criminal, responsible husband and father, it led him to take that out of his bag and he ended up back in the hospital. So
a matter of cultural competency, just
exactly.
that's a part of the job.
That's a part of the job. And it's something we need more of. We need leadership that promotes culturally competent care. And we need leaders who hire diverse staff members. You should not be in a hospital where the only faces you see that are brown or Black are in housekeeping or transport. Why don't you have nurses that reflect your community? Why don't you have doctors that reflect your patient base,
Yeah. Now, what advice would you give? Because particularly at this time of COVID, so many people are trying to navigate the system while they themselves and or family members are fighting illness themselves. You are someone who changed laws while you were going through this ordeal. So what are some things that can be done and what advice would you give to folks who are in that same situation?
So that touches on a couple of things. Number one, so often people think of racism as blatant. It's not always blatant. Sometimes it's subtle. Many times it's the subtleties, it's the dismissiveness. So what I'm hearing, especially during this time of COVID, is the dismissal. People being dismissed. I just saw a story on CNN. A gentleman lost his father and nearly lost his mother. His father was sent home with full-on COVID symptoms from 3 different hospitals. Went back to that 4th hospital before they took him in, and it was too late. So in this time where in larger numbers, African Americans and people of color are being dismissed and sent home to relax, drink some hot tea, have some soup, take some aspirin for your fever, instead of being admitted and treated early. You've got to stay vigilant. You've got to stay diligent, resilient. Don't take no for an answer. If that hospital doesn't admit you, you get on the phone with your primary care physician and have that person go to bat for you. You go to the next ER if you can. You keep at it until somebody lets you in that hospital. And then right now, unfortunately, many hospitals are not letting people come in and have an advocate at the bedside. So you're by yourself, you're scared, you're afraid. This is your best friend. This phone, you can use WhatsApp, you can use FaceTime. Facebook has a thing, and I just learned that Instagram, you can do a video chat. Find out from your doctors what time they're coming in to see you, and coordinate with your family members, with your loved one, with your advocate, and say, my doctor's coming in at 5. Please be available. I want to do a chat with my phone so you can hear what I'm hearing about my condition. And if you have questions, you can help ask them. because we need that connection. And oftentimes a patient is laying there, they can't breathe, they can't talk, they need help. And if you're in a situation where you're being dismissed and, you know, for example, I was on my 8th surgery, facing another surgery. And many in healthcare have this myth that African-American skin is tougher than white people's skin. So it doesn't hurt as much when you get a shot. I'm here to tell you that's not true.
And we don't feel pain, right?
And we don't feel pain. And if we do feel pain, a lot of times we're saying it because we're drug seeking. So I'm laying there, I'm on my 8th surgery, about to go to my 9th surgery. They've got me on a cocktail of morphine, Toradol, Dilaudid, you name it. I'm like, and it's keeping me at like a 2, not even a 0 or a 1 on the pain scale. So it's the middle of the night. They just had to redo my bandages because the wound was seeping and bleeding so much I was bleeding through and onto the sheets. So they had just done this big massive dressing change. And a nurse came in and I said, can I get some more pain relief here? Because I'm hurting after all that. And she's like, oh, no, ma'am, no, we've given you all we can give you. And we have to make sure you don't get addicted. And there's an opioid crisis. And she starts, and I'm looking at her like, excuse me? I'm in the ICU in critical care. I just had a massive dressing change and you're quoting me statistics on opioid abuse.
Yeah. Not the time.
I have flesh-eating disease, lady. This isn't a drug-seeking moment. But so often people have in their heads preconceived notions of who we are. And it's something that a lot of times when you're getting care, you almost have to give a resume of who you are to get treated just the same as someone else.
And that's the last thing you want to do. Oh, we've got the questions coming in for you. Let me see. We have one. How can more people get involved with patient safety advocacy?
Oh, thank you. God bless you, whoever said that. Number one, everybody's a patient advocate. That's first. It's just whether you start to engage that, because number one, you have to look out for your family. Everybody out there watching this, if you're not wearing a mask, if you're not social distancing, if you are not washing your hands regularly, then you are the anti-patient advocate, okay? This thing is real and your relatives are at risk. So that's first. Start by advocating for the safety of your family right now. Mm-hmm. And then there are so many organizations out there looking for help. I'm on the board of the Patient Safety Movement Foundation. You can go to that website, and there we always are looking for patient stories. And in fact, we're trying to have stories in every state. Mm-hmm. There's a Patient Safety Action Network, which is made up of a powerhouse group of advocates, which is like an offshoot of the former Consumers Union Patient Safety Movement, which was like the grandfather of all patient advocacy movements. That's where I learned about patient safety and advocacy, from Lisa McGifford and the wonderful people at Consumers Union who publish consumer reports. There are other organizations, someone who has C. diff, there's Sepsis Alliance, there's the Peggy Lillis Foundation, there's Justin's Hope, there's Niles Project, there's Health Watch USA. On Facebook, there's a group started by a nurse, Suzanne Shinazy, who does amazing work with advocates across the country. There's Patients Like Me. Get on the computer and Google patient safety.
And we're going to try to give some of these links on the page devoted to this. Yes, we have another question about someone becoming their own patient advocate, because they're asking, does it get a response if you have somebody in the room with you, which you said was a challenge now?
Yeah, it's a challenge right now. The best that you can hope for is a conversation on the phone between yourself, the doctor, and a patient advocate. Because right now, with especially in the state of Ohio, I've been helping a family right now, and the son is in the hospital, and the mom was able to go there last week, but as of yesterday, they said no more, ma'am, you can't come. You're going to have to do the phone because the numbers are off the chart. in Ohio, and our county here is in jeopardy of going purple. So they have locked down the hospitals. You can't do it.
Wow. Here's
Yeah.
another question. What types of resources are available if you find yourself in a compromising position where you need to advocate for yourself?
So the power of escalation is something you need to know. Number one, I'll tell you what my mother taught me: you get more bees with honey. So always remember that, even in the midst of being mistreated, and especially Black people, we've been mistreated all our lives. Trust me, I've had teachers as far back as elementary school saying, you know, I've been called the N-word by teachers. When I became the head of cheerleading in high school, in junior high, we lost our cheerleading advisor because our cheerleading squad was so diverse. She told another teacher, I'm not going to be coaching a group of, and she quit. So racial disparities, racism, comments is nothing new to Black people. So here's the deal: Black, white, Mexican, Filipino, whatever you are, number one, don't engage in a negative way with your caregiver that's giving you drama. Okay. Escalate to the nurse manager. If you don't get satisfaction from the nurse manager, then you say, ask, can you speak to the head of nursing education and the whole nursing department there? If you can't get that, most hospitals now have what's called a patient engagement representative, an ombudsman, or a patient liaison. So find out who's at the top of the food chain for that. So learn to escalate up as you need it. Articulate your concerns in terms that they understand. None of that, they're trying to kill me, they hate me. No, don't, keep the emotions out of it. I'm getting substandard care. This is not evidence-based best practices. This is not the standard of care that your hospital should be giving. I wasn't giving the appropriate care, or I'm not getting the appropriate responses, or culturally sensitive, or what they said was unprofessional. Use those kinds of terms that speak immediately to the situation in a way that business people understand. And you take the personalness out of it.
Yeah.
Then if you have insurance, you need to get on the phone with your insurance because they pay. So you need to get on the phone with your patient liaison or patient ombudsman for your health insurance company, and especially if you have Medicare, and you need to let them know you're having a problem in a facility that they're paying to take care of you. Trust me, you'll get some response.
Yeah,
Then,
everybody understands that bottom line, right?
yes, indeed. Yes, indeed.
Yeah, we have one question. Do you think you would have gotten a better response from the doctor if your hair had been coiffed and you've been carrying a Prada bag?
Let me tell you something. Okay, I gotta stay professional.
Okay. Yeah.
Okay, first of all, yes. Had my hair been combed and look, I knew I was looking rough. I wish I had a picture I could hold up and show you right now.
Yeah.
My hair was, as they say, nappy. I was sweaty. I was swollen. My eyes were puffy and red. But here's the deal. I shouldn't have to be beautiful, laying there looking good. I'm sick. You already know I'm vulnerable right now. Why are you judging me? Give you a perfect example. And this happens even with men. For example, my dad, Vietnam veteran, served his country. My dad, when he was young, was thrown from a fast moving car. My dad had a lead foot, fancy car, speeding on car accident, ejected from the vehicle. They took him, this was in West Virginia, back in the 50s, took him to the White's Hospital, and they were gracious enough to let him be there, and they got him stabilized, but it wasn't the colored hospital, so you got to go. You stabilized, now you got to go. So my dad didn't even know he had broke his back.
Oh my goodness.
Yeah, it healed on its own. So we're in the hospital. Little nurse is coming in with her little attitude, and she's like, your father's kind of persnickety about, can you help me with my pillow? And I'm looking at her and I said, excuse you. First of all, that man that you keep calling Ron and Sunshine, his name is Mr. Cole. And if you can't call him Mr. Cole, then you call him Mr. Ron, because he's old enough to be your grandfather. And if he was a snow white haired elderly white man looking like Charles Stanley, Pastor Charles Stanley, in that bed, you would be so reverent. oh, hello, Mr. Cole, how are you today? Or Mr. Ron, can I help you? That's another form of degrading. And it's kind of like back in the day, the Pullman porters, my great uncle Bob was a Pullman porter. When the whites didn't want to address them by their name, they called everybody George.
Called
Every
everybody
black man was George.
It
They
was the
didn't
name of the owner of the company. I mean,
name of the owner. Yep, George Pullman.
yeah,
He actually hired Uncle Bob. And you
yeah,
were George. If they wanted to grade you, I won't call you by your name. You just George, because I don't need to know your name. But I had to explain to this young lady, I said, my father's careful about, and he needs his pillows a certain way. And he asked you very kindly because he was ejected from a car and broke his back and it healed inappropriately. And I said, and he also has some vertebrae in his neck that we went to talk to a surgeon a couple years ago, and the surgeon said, you need a donut because even if you turned your head too quickly, you could break your own neck and be paralyzed. So when he asked you to please help him adjust his pillows and help him. I shouldn't have to give you all this elaborate history for
yeah,
this elderly, wonderful servant of our country, decorated veteran. Those that's Camp Lejeune and his military class and some ribbons and him in Vietnam. I shouldn't have to give a dossier on why this man deserves your help getting his pillows fluffed to
yeah.
comfort him.
And that's like the point of the whole thing. Every patient deserves this. And you've been such a patient advocate. I think everybody has gotten so much good advice from the personal and inspiration of all that you've done. And we're going to close out now. I wonder if you just have one, people have said they're inspired by you and you've dealt with coping with the traumatic experience that so many people are going to. So in your closing advice, what kind of advice would you give people for coping with this trauma that you've been with? And you've got a smile on your face and you're advocating for others. Is there some secret you would like to leave us with?
Well, don't be fooled. It's not been easy. It has not been easy. I lean on my faith. I trust in God. I have a support system around me. You must have a support system around you, your family, your friends, and you must educate yourself as a patient. And you must learn about your condition so that you can help take care of yourself. And where you're not getting the care that you deserve, that you're entitled to, and that you need so desperately to heal and be better, reach out. There are so many wonderful people in healthcare. That's the thing. Everybody's not a racist. I have had the best of the care and love. But where the system falls down and where there are the cracks, we got to work on those. We got to be through the education of people, through cultural competency. You've got to show them the best of who you are so that they see something differently than the negative images that they've been seeing all their life on TV and in the news. You're combating that every day because they don't know, because they probably never even talked to somebody like you before. I had a nurse who was frustrated. She was like, why are all these white people coming to see you? Like, don't you have any black friends? I was like, it bothered her. Donna was Japanese, Anna's Mexican, her husband is German Japanese. I had a Filipino, I had a Jewish friend next to my bed. I had black friends that she just wasn't on shift when they came. But why should it bother you that my friends look like a rainbow coalition? That's the way it should be.
Yeah.
But she had a box and I didn't fit in it. So remember, you're not going to fit in people's boxes. So we have to help them understand better and show them better so they know, oh no, that's not us what you saw. This is us. This is us, you know.
Well, I want to thank you because you've left people with great advice, but also some hope.
Thank you.
And you're also working for solutions.
Yes.
I can't tell you how much that your conversation has helped so many people. And I want to thank everyone, all of our listeners, for joining us in the second in our series of conversations on racism and healthcare. Thank you so much, Alicia Cole. Thank you. Thank you. And you can read more about her and her work and about all of these organizations. And she was dropping some good tips there that I think you might have missed. So we want you to do that too. And we're going to have a page devoted to this series. So back to you, Tequila.
Thank you.
So thank you. On behalf of Everyday Health, WFAE Public Radio, and Clear Health Costs, thank you for joining today's conversation. Please be sure to join us next week as we talk to Dr. Priscilla Pemu, who is a personal health coach who trains medical students and new medical doctors in the specialty of internal medicine at Morehouse School of Medicine on how to engage with tools and resources to empower patients, their families, and their communities. Visit clearhealthcosts.com/racism and wfae.org/race and healthcare for more information on the Racism in Healthcare series, and for more information on the impact of racism on managing overall health and well-being and chronic health conditions, visit everydayhealth.com. See you next week. Thank you, and have a great day.